you are staring at your CRRT machine, looking at a high pressure filter, TMP, Delta P, don't be scared anymore. Let's chat about it. My name is Leah. I've been a CVS nurse for 18 years, and today we're gonna talk a little bit more about alarm troubleshooting, and specifically today, we're gonna focus in on our filter pressure, our Delta P, and our TMP. You should be trending and watching those pressures. If you just treat an alarm when it happens, it's probably been building up for a very long time. Very unoften do I have alarms that just come out of the blue, and it's not like something like a cord is kinked. Most of the time I know that it's headed that way. I'm trying to head it off, because if I let that filter clog or clot where I cannot return the blood to the patient, that patient loses blood. Filter pressure, what is normal for most of the pumps that I've worked with is 100 to 250 millimeters of mercury. For my TMP, normal is going to be less than 450 millimeters of mercury. TMP is clogging. So this is a patient that has tons of just nasty big molecules, and it's clogging up the filter. A pressure drop or my Delta P is going to be clotting. This is a patient that's having coagulation issues. Their blood is just hypercoagulated for different reasons. Or maybe it's a patient that for a specific reason cannot have an anticoagulation. For any of these, filter pressure increasing TMP, increasing Delta P, as I see these things increasing, I am trying to head them off. I'm trying to get those pressures down, or at least keep them from going up, so that I don't lose my filter. Whenever I reach a certain point, if my filter is getting clotted, is getting clogged, I'm changing that filter out before I lose the circuit. Anytime I'm starting to get alarms, especially if they come on suddenly, it's not a slow buildup, I'm gonna check for kinks in the tubing anywhere. I'm going to visually assess that filter for clotting. You can see it a lot of times. I'm gonna change that filter before it clots off, and I'm gonna make sure the anticoagulation is in place, therapeutic, and appropriate for that patient if at all possible. I will also point out that if you're taking care of a patient that's increasing their TMP, also look at the return line pressure. If the return line pressure is also elevating, adjust that first and see if that doesn't fix your TMP. The TMP is just a pressure gradient that reflects how hard fluid is being pushed across that membrane. If there's a problem with the blood returning to the patient, it will also increase your TMP even if your filter is okay. So always look at that return line pressure and see if there's something going on there that you can troubleshoot as well. Remember, trend your numbers. If your numbers are getting on the higher edge, talk to your provider, see if there's something that you can add. Can you add some PBP, pre-blood replacement fluids? Can you change their anticoagulation goals? What can you do to preserve this filter? And if you're at the point where it's getting too close to where this filter may clot off or clog off, then let's go ahead and get the filter changed before your patient actually loses the unit of blood that's in that CRRT machine. Continue to follow along, and we're gonna talk about all things CRRT.